You think you know your dog better than anyone, right? But what if I told you your best friend could be silently screaming for help, and you're missing every single warning sign until it's too late? Dogs, unlike us, are masters of disguise when it comes to pain and sickness. It's an ancient instinct, buried deep in their DNA, to hide any weakness that might make them vulnerable in the wild. This incredible ability to mask discomfort is both a survival trait and, unfortunately, one of the biggest challenges for us, their human companions. When they finally show obvious signs of being unwell, the problem has often progressed much further than we realize, making treatment harder and outcomes less certain. That's why recognizing the faint whispers of illness, those subtle, almost imperceptible shifts in their daily routine and behavior, is not just helpful, it's absolutely crucial. Catching these hidden cues early can be the difference between a quick recovery and a prolonged, serious battle, or worse. Today we're going to pull back the curtain on 7 of these hidden signs that most owners completely miss, revealing what your dog might be trying to tell you, so you can act before it's too late. Dogs, by their very nature, are stoic creatures. They don't complain or tell us when something hurts in the same way a person would. This means that by the time you see them clearly limping, refusing to eat, or vomiting severely, the underlying issue might have been brewing for days, weeks, or even months. Think about it. A small ache in their back, a slight twinge in their stomach, a general feeling of being off, these are things they'll try to push through, maintaining their usual happy-go-lucky demeanor for as long as possible. Their survival instincts tell them to appear strong, even when they're not. This is why our role as their caretakers is so incredibly vital. We need to become detectives, observing their every move, every habit, every subtle shift. It's about more than just affection. It's about understanding their unique language, the one they communicate through action, not words. The sooner we pick up on these signals, the sooner we can get them the help they need, which often leads to simpler, more effective treatments and, most importantly, a much better chance for a full recovery and a longer, happier life together. Early detection isn't just a medical term. It's a lifeline for our best friends. Now, a dog suddenly refusing to eat for a whole day is a pretty clear red flag, right? But what about the more subtle hints that often fly under the radar? We're talking about things like your dog, who usually devours their food in seconds, now taking their sweet time, nibbling rather than gulping. Or maybe they used to love their kibble, but now they're leaving half of it in the bowl. Perhaps they turn their nose up at their favorite treat, the one they'd usually do backflips for. I once had a friend whose golden retriever, Max, started leaving just a few pieces of food in his bowl each night. My friend just thought Max was getting pickier in his old age. It wasn't until a week later, when Max also started being a bit lethargic, that a vet visit revealed early-stage kidney disease. That slight shift in appetite was the first quiet alarm bell. These minor changes might seem insignificant, but they can be your dog's way of telling you something is off. They could indicate anything from simple nausea or a toothache making it painful to chew, to more serious issues like digestive problems, internal pain, or even early signs of organ disease or certain cancers. Don't just brush it off as your dog being finicky. If their eating habits change even slightly for more than a day or two, especially if they lose interest in food they once loved, it's worth a closer look. We all know our dogs need water, but how often do you really pay attention to how much they're drinking? An obvious increase in thirst, what vets call polydipsia, is a classic, yet often overlooked sign. You might find yourself refilling their water bowl far more frequently, or notice them lingering at the water dish longer than usual. You might even catch them trying to drink from unusual places like the toilet or a dripping faucet. This isn't just about being hot after a long walk. Persistent excessive thirst can be a critical indicator of serious underlying health conditions such as diabetes, where their body struggles to regulate blood sugar, or kidney disease, where their kidneys can't properly concentrate urine. Both of these conditions require immediate veterinary attention. On the flip side, a decrease in thirst is equally concerning. A dog not drinking enough can quickly become dehydrated, leading to a cascade of other health problems. Maybe they're feeling nauseous, or perhaps they have pain that makes moving to the water bowl difficult. Monitoring their water intake closely means being aware of their baseline. If you usually refill the bowl twice a day and suddenly it's 3 times or only once, that's a signal you shouldn't ignore. Grab a measuring cup and track their daily water intake for a few days if you suspect a change. It provides valuable information for your vet. This is perhaps one of the most subtle, yet profound indicators that something is wrong. Your dog's personality is something you know intimately. They have their quirks, their routines, their moods. So when that familiar temperament shifts significantly, it's a flashing neon sign. Is your usually outgoing, tail-wagging social butterfly suddenly withdrawing, hiding under furniture, or avoiding interaction? Or has your calm, gentle dog become surprisingly irritable, growling or snapping at family members or other pets for no apparent reason? Think about Bella, my neighbor's normally playful beagle. She used to greet everyone with a frenzy of excited barks and wags. But one day, Bella started spending more time curled up in her bed, barely lifting her head when people came over. My neighbor initially thought Bella was just getting older or a bit depressed. It turned out to be a severe ear infection that was causing her immense pain and discomfort, making her want to be left alone. Lethargy is another common behavioral change, a general lack of energy or enthusiasm. Your dog might sleep more, be less interested in walks, or not respond to toys they usually adore. Conversely, some sick dogs become restless, pacing, panting, and unable to settle down. Any notable shift in your dog's usual temperament, whether it's increased clinginess, unusual aggression, newfound shyness, or a general sense of unease, warrants a veterinary investigation. They can't tell you in words they don't feel right, but their actions speak volumes. Nobody loves talking about dog poop and pee, but paying close attention to your dog's bathroom habits is absolutely critical. Any alteration in the frequency, consistency, color, or even the smell of their urine and stool can be a vital clue to their health. Is your dog straining to defecate, suggesting constipation, or passing unusually loose, watery stools, indicating diarrhea? Both can be signs of digestive upset, dietary issues, parasites, or even more serious internal problems. Then there's the urine. Is your dog suddenly peeing much more frequently, or having accidents indoors when they're usually perfectly house-trained? This could point to a urinary tract infection, bladder stones, or even diabetes or kidney issues. Pay attention to the color. Dark, cloudy, or reddish urine is never normal. The presence of blood in either urine or stool, even just a few drops, is a serious red flag that requires immediate veterinary attention. It could signify internal bleeding, severe inflammation, or other life-threatening conditions. Regularly checking your dog's waste might feel a bit gross, but it's one of the most direct ways your dog communicates their internal well-being. We often associate weight loss with illness, and for good reason. A sudden unexplained drop in weight can be a sign of many serious conditions, from metabolic disorders to cancer. But what about the subtle changes that often go unnoticed, or are dismissed as just part of aging? A dog slowly losing a pound or two over several weeks might not seem alarming, especially if they have a thick coat that hides their frame. Yet, this gradual decline can be just as significant as a rapid one. Even more hidden sometimes is unexpected weight gain or bloating. While packing on a few extra pounds could simply be too many treats and not enough exercise, sudden or unexplained weight gain, particularly around the belly, can be a worrying indicator. It could be fluid retention, which suggests heart or kidney problems, or internal organ enlargement, potentially pointing to tumors or other serious conditions. Bloating, especially when accompanied by discomfort or restlessness, can even be a sign of a life-threatening condition called gastric dilatation volvulus, GDV, or bloat, where the stomach twists. Feeling your dog's ribs and spine regularly, and doing a quick visual check of their overall body shape, can help you catch these subtle weight fluctuations before they become major problems. Your dog's activity level and how they move are powerful indicators of their comfort and well-being. If your once energetic dog, who loved to chase balls for hours, now tires easily after just a short walk, that's a change worth noting. It's more than just getting older. It could signify pain, heart problems, respiratory issues, or even anemia. Beyond just energy, pay close attention to their gait, how they walk and move. Are they struggling to jump onto the couch or into the car, something they used to do with ease? Are they hesitant to go up or down stairs? Do they seem stiffer, especially after resting? You might notice a slight head bob, a subtle shift in weight, or a favor towards one leg. It might not be an obvious limp, but a general reluctance to move, a stiffness, or a decreased range of motion can be signs of arthritis, hip or elbow dysplasia, back pain, or other musculoskeletal issues. I remember Max, a Labrador, who started avoiding his usual leap onto the bed. His owner just assumed he was becoming lazy. It took a vet visit to diagnose him with early-stage arthritis in his hind legs. These subtle changes in mobility are often early warnings that something is causing them discomfort or pain. Dogs spend a fair bit of time grooming themselves, but how much is too much? Excessive scratching, licking, or chewing at specific body areas is a huge, often ignored red flag. We tend to think of it as just allergies or a hot spot, and while those can be true, the underlying cause needs to be identified. Is your dog constantly gnawing at their paws, licking their belly raw, rubbing their face against the furniture more than usual? This incessant self-grooming can indicate skin allergies, parasitic infestations like fleas or mites, bacterial or fungal infections, or even underlying pain in that area. Beyond their behavior, a visual inspection of their skin and coat can reveal a lot. New bumps or lumps, even small ones, should always be checked by a vet. Redness, inflammation, flaky skin, or unexplained hair loss in patches can all point to problems. Your dog's coat should be shiny and healthy. A dull, dry, or greasy coat can sometimes signal nutritional deficiencies or internal health issues. Don't dismiss that persistent itch or that small new bump. Your dog's skin is their largest organ, and often, it's the first place internal problems manifest. Understanding these 7 hidden signs empowers you to be a more vigilant, proactive pet parent. Your dog relies on you to be their advocate, to notice the things they can't tell you. From the slightest change in appetite to a barely perceptible limp, these subtle shifts are your dog's way of communicating. Don't wait for obvious, severe symptoms to appear. By the time those show up, the situation is often much more serious and harder to treat. Trust your gut instinct. If something just feels off with your dog, even if you can't quite put your finger on it, it's always best to consult your veterinarian. Early intervention is not just a preference. It's often the key to a faster recovery, less suffering for your beloved companion, and ultimately, a longer, healthier, and happier life together.